Hello, everybody. Dr. Vasquez here with some good news and some not so good news. So, today is February 7th, I believe, of 2021. I just recorded a video on the relationship between vitamin D and pain, but my primary microphone didn't work. And so the recording is that from my secondary microphone, which picks up a little more echo, and I'll have to spend more time cleaning up the audio. So I had hoped to review this topic with some new information, which I did. I had hoped to make it shorter than the previous video that I did on vitamin D and pain. The other one was 30 minutes, and this one turned out to be practically 30 minutes. By the time I edit it, it'll probably be 25 minutes. So again, I tried to be fast. I tried to make it faster. It turned out to not be faster. The audio quality was compromised, but it is still good information. And I hope you enjoy it. I hope you get some good use out of it. And I either may or may not make a third version of this topic. We'll just see how well this one cleans up. But thank you for your attention, and sorry for the less than perfect audio. Hello, everyone. Dr. Alex Vasquez here, and today I believe is Sunday, February the 7th of 2021. Hopefully by now, some or most of you have seen the video that I did a few weeks ago on the relationship between vitamin D and pain. Today I want to revisit that topic and approach it a little more efficiently, a little faster, and also from a different perspective. And that different perspective comes from my reading of this document from the United States Food and Drug Administration, the FDA. I just read this a few weeks ago, and what I was reviewing on the FDA website was kind of the newer, if there are updates, and sometimes there are in various sections, some of the newer requirements for what they call structure and function claims. So in the United States, the Food and Drug Administration, the FDA, US FDA, limits what nutrition companies can talk about in terms of making claims about their products. And you can see some of that language represented on this page, again, from the FDA. For example, nutrition companies can only talk about structure and function, claims of general well-being, and claims related to a nutrient deficiency disease. So, for example, if a nutrition company says we have vitamin D and vitamin D is useful for the treatment of pain, then that would be actually, according to the FDA, that would be a drug claim, and that would be a violation and result in fines and all types of bureaucratic harassment. A nutrition company can't say that vitamin D alleviates pain, but a nutrition company could say that vitamin D supplementation alleviates vitamin D deficiency, and one of the manifestations of vitamin D deficiency is pain. So again, we can't make the claim from a nutrition standpoint, we can't make the claim that vitamin D alleviates pain, but we can say that vitamin D supplementation alleviates vitamin D deficiency, and a manifestation of vitamin D deficiency is pain. So that's the reason that I'm kind of revisiting this particular presentation. Not that the conclusion is going to be different, but I will provide a few more details that I've learned over the last 2 months since I made the previous video. So let me just look at this page real quickly to see if I want to read anything else. Nutrient deficiency disease claims describe a benefit related to nutrient deficiency disease, like vitamin C and scurvy. But such claims are allowed only if they also say how widespread such a disease is in the United States. The manufacturer must have substantiation that the claim is truthful and not misleading, and submit a notification to the FDA. And nutrition companies, I'm sure you've seen this on nutritional supplement containers and bottles, they have to include a disclaimer that the FDA has not evaluated the claim and that the product is not intended to diagnose, treat, cure, or prevent any disease. So those are the limitations placed on nutrition companies. So hopefully you understand what I'm saying there. And again, having just read this document about 10 days ago or so, that caused me to see if I could recouch my presentation on vitamin D and pain more clearly from the perspective of deficiency. To me, that was already clear, but I don't think that I stated it as such. So let's see if we can engage in that conversation. So here's what I think doctors need to know. Doctors need to understand the relationship between vitamin D deficiency and pain. So let's look at some data that I've reviewed recently. Medical doctors receive, of course, essentially zero formal training in clinical nutrition, and that includes medical school and postgraduate residency programs. That's not simply my opinion. You don't have to like it. It's just the fact. The fact is very well documented. Those of us who have been to medical school realize that we receive no training in clinical nutrition. A brief review of, I believe it's either chapter 7 or chapter 9 in Robbins' Pathologic Basis of Disease to talk about nutritional deficiency, only the most extreme and only the most classic deficiencies. Vitamin D deficiency causes rickets, scurvy, or vitamin C deficiency causes scurvy. Vitamin A deficiency causes increased susceptibility to infection, etc. Only the most classic and most severe. Only the most classic and most severe. So it's clinically worthless. Medical doctors themselves suffer from high rates of vitamin D deficiency. This has been shown throughout, well, in two studies, at least two studies in the United States and in other countries. So we can reasonably assume that this is a global problem, especially when we look at the incidence of vitamin D deficiency in the general population. Medical patients, of course, suffer high rates of vitamin D deficiency. Usually we're looking at least 60 up to, let's say, 90% of doctors are deficient and also their patients. Vitamin D deficiency in infants and children classically presents as rickets, which is skeletal deformity due to inadequate bone mineralization and therefore inadequate bone strength. So the bones are not simply soft, but they're actually deformed in classic rickets. And in Europe, you could see rickets all the time. So this isn't something that just occurred in the past, made it into the textbooks, and now doesn't exist anymore. You can see rickets in real time walking any street of Europe. Because Europe, of course, the entirety of Europe is a northern latitude. Via the same mechanism active in rickets, vitamin D deficiency in adults commonly presents with various types of pain, especially bone pain secondary to subperiosteal edema. That is secondary to failure of bone mineralization, which is itself secondary to lack of calcium and parathyroid hormone-induced loss of phosphorus. So in adults, we don't see rickets because they are what we call skeletally mature. What we see is something called osteomalacia, which means softening of bone, and especially the regenerating part of bone, which is right under the periosteal covering, which is itself highly innervated with sensory neurons. So when people are vitamin D deficient, they don't absorb calcium as efficiently. So long story short, eventually they are going to become calcium deficient. In early vitamin D deficiency, the body compensates by producing more parathyroid hormone to increase calcium absorption from the gut. However, that leads to loss of phosphorus in the urine. So for most vitamin D, let's call it compensated vitamin D deficiency. In early or compensated vitamin D deficiency, what you see is a reduction in body calcium levels and also a reduction in phosphorus levels. The reduction in calcium level is due to the vitamin D deficiency itself, and the reduction in phosphorus level is due to the compensatory increased secretion of parathyroid hormone, and that causes renal loss of phosphorus. So the take-home message is, what we see in vitamin D deficient people is lack of calcium and lack of phosphorus. Without the calcium phosphate product, as it's called, the bones cannot be properly mineralized. When they're not mineralized, the body deposits a collagen matrix that is what's called hydrophilic, which means it absorbs water, and so it becomes edematous or swollen. That occurs right under the periosteal layer. and puts pressure on the periosteum, and that causes pain. So that is how vitamin D deficiency causes osteomalacia, subperiosteal edema, and that presents with bone pain. It could be back pain or limb pain. So the pain can be in the central axial skeleton or in the periphery in the limbs. Point number 6, in this conversation and consistent with the FDA restrictions that I already mentioned, I'm not stating that vitamin D is a cure for pain, but rather what I am stating is that vitamin D deficiency directly causes skeletal pain and also exacerbates other types of pain. So now let's look at the global prevalence of vitamin D deficiency. If we look at the United States and Canada, we're looking at least 40% and probably more reasonably about 60% of the population. And if you think about it, that's amazing to think that 40 to 60% of two of the supposedly most developed countries on the planet have vitamin D deficiency. Well, of course, we can look at other countries as well. If we look at the UK, Great Britain has almost 90% vitamin D deficiency in the winter and 60% in the summer. So right now, for example, in February, 90%, let's say, of the British population is vitamin D deficient. And that deficiency increases their risk for complications of deficiency, depression, low back pain, and increased susceptibility to infectious diseases, respiratory infections, viral infections. So you'll notice what I'm working hard to say, to make this video slightly different or look at it from a different angle from the previous videos, is I'm not saying that vitamin D supplementation prevents viral infections. I'm not saying that. What I am saying is that vitamin D supplementation corrects vitamin D deficiency, and a manifestation of vitamin D deficiency is depression, increased risk of infection, and also increased risk, severity, frequency of chronic pain. So again, Great Britain right now hovering around 90% vitamin D deficiency. If we look at the far northern European countries, Scandinavia, 52%, almost 80%, etc. So those countries, some countries, not all countries, and sometimes they have it, sometimes they don't, but the reason that some of the far northern European, Scandinavian countries actually have less vitamin D deficiency is because they know they've got vitamin D deficiency, and they've implemented public supplementation programs and public advisory programs, whereas the other countries just haven't done that. And other reasons exist for that in terms of their social structure and their healthcare reimbursement systems and all that. So let's look at other countries. Let's look at New Zealand, 90% and 90% in men and women in the winter. So, or perhaps that's year round. It doesn't specify as the other ones did. So again, New Zealand, about 90% deficient, and Australia, about 73% according to this. So in one of my videos from the end of November, I believe, I said, if you can hear what I'm saying and you speak English as your primary language, you're probably vitamin D deficient. And I said that kind of spontaneously at the time, but it's still true. If you speak English as your primary language, meaning, that's just another way of saying, if you're in the United States, if you're in Canada, if you're in Great Britain, if you are in Scotland, New Zealand, Australia, if you speak English as your primary language, you're probably vitamin D deficient, unless you're taking a supplement. So I showed you this previously. Let's look at it again, and then we'll get into some new slides that give more details. So here's how vitamin D deficiency causes or exacerbates pain: through osteoporotic fractures, impaired healing of various types of fractures, accelerated osteoarthritis. I'll show you that in just a moment. Again, I showed you that before, but I'll show it to you again from the article that I'll reference. The bone pain of osteomalacia, especially back pain and limb pain. So let's put all that together and call it bone pain. We also see hyperinnervation of muscle, increased pain reception, transmission, perception, central sensitization, And those are mediated at least partly through what I call intracellular hypercalcinosis in an article that I published, 15 years ago. So that was 2006. So if you look at all of that together, I call that nerve hypersensitivity. And mostly we're talking about the central kind of neuroaxis, the brain and spinal cord. So bone pain is a peripheral phenomenon. Nerve hypersensitivity is central through central sensitization, but also peripheral due to point number 5 here, which is hyperinnervation of muscle. We also see gut dysbiosis, increased intestinal permeability that leads to systemic inflammation, and an inability to kind of normalize immune function, as I'll show you in the last point here. Also magnesium deficiency, and again, systemic inflammation or autoimmunity secondary to lack of immune regulation and T regulatory cell induction. So I call that systemic disturbances and systemic inflammation. So those are the ways that vitamin D deficiency contributes to chronic pain. Therefore, the alleviation of vitamin D deficiency helps to alleviate various types of pain. But we can't say, in the nutrition world, we can't say that vitamin D alleviates pain, because then that would be making a drug claim. So I'm trying to get you to see kind of the gymnastics and ballet that the nutrition companies have to engage in order to educate people appropriately, but not get in trouble with bureaucracy. Here's the article that I wrote back in 2004. You can get this article online. This was published in Alternative Therapies in Health and Medicine, September, October of 2004. You can see there our proposed optimal range. And if I may say so, if you're only going to read one article on vitamin D in your entire lifetime, then in my opinion, this is the article that you should read. You can download this from academia.edu. And you can see the article identifier there, which is 40, 42, 97, 91. And our article was titled Clinical Importance of Vitamin D, Cholecalciferol, so that's vitamin D3, a paradigm shift with implications for all healthcare providers. And our conclusion, the final sentences of this article, stated, until proven otherwise, the balance of research clearly indicates that oral supplementation in the range of 1,000 international units per day for infants, 2,000 international units per day for children, and 4,000 for adults is safe and reasonable to meet physiologic requirements, to promote optimal health, and to reduce the risk of several serious diseases. Safety and effectiveness of supplementation are assured by periodic monitoring of serum 25-hydroxyvitamin D and serum calcium. So that's what I said 17 years ago, and it's still correct. Let's look at some of the details from that article specific to pain. So when people are vitamin D deficient, they have systemic inflammation, and we could say that systemic inflammation accelerates joint degeneration, which is otherwise more commonly known as osteoarthritis. So when people are vitamin D deficient, they have what we call or think of as accelerated osteoarthritis. Now, these days, we could also add that it probably relates to shortened telomeres and, some other changes in genetic expression. But let's just conclude, regardless of the different mechanisms involved, and certainly several mechanisms are involved, when people are vitamin D deficient, they have accelerated osteoarthritis. This has been shown in several studies, obviously in humans. We know that patients who are vitamin D deficient are going to develop eventually osteomalacia. That leads to musculoskeletal pain. We'll look at that data again in just a moment. So we know that vitamin D deficiency causes pain, and correction of vitamin D deficiency with supplementation alleviates the pain of vitamin D deficiency. Also, just to kind of foreshadow what I'm also going to add here and what I already did mention, is kind of the central sensitization effect of vitamin D deficiency, which is at least partly mediated as increased glutaminergic neurotransmission, which is a factor involved with epilepsy seizures and what some people would consider to be a variant of epilepsy, which is migraine headaches. So when people are vitamin D deficient, their brain becomes more inflamed. A consequence of that inflammation in the brain is seizures and epilepsy, and that can be the presenting manifestation. Seizures and epilepsy can be the presenting manifestation of vitamin D deficiency. And also we see a correlate between glutamate and central sensitization also in migraine headaches. So again, very clearly a manifestation of, or some manifestations of vitamin D deficiency include accelerated osteoarthritis, which obviously causes pain, musculoskeletal pain due to subperiosteal edema, which I already explained, and also the hyperinnervation of the muscle, which then leads to increased sensory input from that hyperinnervated muscle. And more centrally, we see increased glutaminergic neurotransmission. We associate that with central sensitization of pain, let's say, and also epilepsy, seizures, and migraine headaches. It's all the same mechanism. So again, if you're only going to read one article in your lifetime on vitamin D, I encourage, or maybe you've read a few and you want to read another one, please read this one. Again, it's on my academia page, and the code, as you can see here, is 40429791. Now, this was a very important article published by Michael Hollick in December of 2003, and I cited this in our 2004 review. And he's talking here about the mechanism of vitamin D deficiency induced pain. And I'll show you the excellent summary that he provides here. He says another effect of parathyroid hormone on mineral metabolism. So this parathyroid hormone gets secreted in excess when people are vitamin D deficient. And he says that the excess PTH leads to phosphaturia, which is increased excretion of phosphate in the urine, which leads to low levels of phosphate in the blood. That makes the process of new bone formation impossible. The body deposits more collagen, which hydrates and expands under the periosteal covering, causing outward pressure on the periosteal covering that is innervated with sensory nerve fibers. Therefore, osteomalacia causes dull, unrelenting aching sensation in the bones, and that can often be misdiagnosed as fibromyalgia. And of course, these patients are not going to receive vitamin D from most of their doctors because their doctors don't know about it. But what their doctors do know about are drugs, right? So analgesic drugs and opioid drugs, because this type of pain does not, of course, respond to NSAIDs. And what do most medical doctors use when NSAIDs don't work? They go from there to opioids. So a direct relationship exists between opioid use and opioid dependence and vitamin D deficiency, and this explains why. Here, another classic article. Any article that's going to talk about vitamin D and pain has to cite some of these articles. The one that I showed you previously, the editorial, and then this was the actual clinical research, the original clinical research. What they showed here is that virtually all of their patients with chronic, non-specific, persistent musculoskeletal pain, all of them were vitamin D deficient, severely vitamin D deficient. So for this reason, but not simply this study, all patients with chronic pain should be tested and treated for vitamin D deficiency. Here's a great article as well, a little more recent, Pain Medicine 2014, Vitamin D and Central Hypersensitivity in Patients with Chronic Pain. Vitamin D deficiency, which they defined as less than 50 nanomoles per liter, or that would be 20 nanograms per milliliter, was present in 71% of chronic pain patients, and another 21% had insufficient levels. So I would define their insufficiency as deficiency. So 71 plus 21 brings us to 92%. So 92%, and that's exactly consistent with the previous study. Let's say 92% in this study had vitamin D deficiency. These were chronic pain patients, and that correlated with central hypersensitivity to pain. Again, very difficult to treat clinically with the usual pharmaceutical drugs, totally resistant to NSAIDs because it's not an inflammatory pain. It's what I call a metabolic pain. So again, quite clearly here, we see that vitamin D deficiency causes and or exacerbates pain. In this case, the mechanism is central hypersensitivity. And that helps you explain, and that helps you understand why these patients with vitamin D deficiency suffer from various types of pain. Not simply accelerated osteoarthritis, but nonspecific musculoskeletal pain in the axial skeleton as well as the peripheral skeleton through mechanisms that are also central in the brain and spinal cord and also peripheral through hyperinnervation. Here's a great article from the Journal of the American Board of Family Medicine in 2009, Improvement of Chronic Back Pain or Failed Back Surgery with Vitamin D Repletion. Obviously, I highlighted and underlined this one because it was very important. Great article. This article reviews 6 selected cases of improvement or resolution of chronic back pain or failed back surgery after vitamin D repletion. Chronic low back pain and failed back surgery may improve with repletion of vitamin D from a state of deficiency or insufficiency to sufficiency. In other words, just give people what they need. Vitamin D insufficiency is common. Repletion of vitamin D to normal levels in patients who have chronic low back pain or have had failed back surgery may improve quality of life or in some cases result in complete resolution of symptoms. So again, vitamin D deficiency causes bone pain and central sensitivity. So we've reviewed now the mechanisms involved, and these involve bone pain, also a central mechanism, or I should say a nerve mechanism, that is central in the spinal cord and brain, and also through hyperinnervation of muscle, and also some other metabolic and inflammatory contributors, including magnesium deficiency as a result of vitamin D deficiency. And of course, vitamin D deficiency also perpetuates and is perpetuated by magnesium deficiency. So hopefully by now you've seen my previous review and critique of this UK publication and policy, which they published in the end of November of 2020, stating that they were going to supplement their deficient population with 400 international units of vitamin D. Well, that is 10% of the adult requirement. So I do find it worth mentioning that this is completely unscientific and completely ridiculous that they would use such a small amount when we've known now, literally for decades, we have known for decades now that the human requirement for adults for vitamin D is 4,000 international units, and they are giving 400, which is 1/10 of what is necessary. Even if they gave 20%, which would be 2,000 international units, that would be much better. But 4,000 is just completely inexcusable. So again, when we look at the entire global population, we are looking at a prevalence of vitamin D deficiency typically between 60 and 90%. How and why does the international medical community or the international so-called medical profession allow that to happen? I don't really think it's a decision made by individual doctors, but I think that medicine and medical education are controlled by certain interests, certain moneyed interests, and they have an interest in keeping doctors ignorant about nutrition, even if the doctors themselves suffer from nutrient deficiency. So here's my commentary on this. Keeping the global population deficient in vitamin D serves the medical profession and the profitability of the pharmaceutical industry by keeping millions, hundreds of millions of people in pain, depressed, and immune suppressed. Therefore, more vulnerable to all types of infections, especially human papillomavirus and various respiratory infections, ranging from tuberculosis to influenza to coronavirus. So, finally, let's look at the facts one more time. Medical doctors receive basically no training in nutrition, and they suffer themselves. It's not simply the patients who suffer. Of course, the patients suffer, but the doctors themselves suffer from their own nutritional ignorance. I hate to say it that way, but that is the way to say it. Vitamin D deficiency in kids causes rickets. In adults, we see osteomalacia, which is characterized pathologically with subperiosteal edema, secondary to failure of bone mineralization. That leads to bone pain exacerbated by hyperinnervation and exacerbated by neuroinflammation. So we can't state that vitamin D alleviates pain because that would be making a drug claim. So we have to say that vitamin D supplementation alleviates vitamin D deficiency. And vitamin D deficiency in adults is characterized by chronic pain. I think I'm content with the way that I've said that. Again, vitamin D supplementation alleviates vitamin D deficiency. What are the characteristics in adults of vitamin D deficiency? Chronic pain, chronic depression, in more severe cases also muscle weakness, but also weakness or debility of the immune system and barrier defenses. That leads to increased susceptibility to various types of infections. So thank you very much for your attention. Again, I encourage you to take a look at my article from 2004. You can get this online for free at academia.edu/40429791. Thank you very much for your attention.